Okay, alveolar margin or process of the mandible, the body, mental foramen, mandibular angle, mandibular notch, mandibular ramus, coronoid process, condyloid process, mandibular foramen, mylohyoid line. The bones, frontal, parietal, occipital, temporal, nasal, zygomatic, maxilla. The sutures, coronal suture, sagittal suture, lambdoidal suture, squamosal suture, internasal suture, intermaxillary suture, frontal squama, glabella, superciliary ridge, supraorbital foramen, infraorbital foramen, nasobones, internasal suture, lacrimal bone, lacrimal duct. In the eye orbit, we have three openings. We have a round optic foramen, and we have a superior orbital fissure and an inferior orbital fissure. In the nasal cavity, right here, we have our nasal septum. The top part is the perpendicular plate of the ethmoid. The bottom is the vomer. These are the inferior nasoconchi, middle nasoconchi. Intermaxillary suture, alveolar margin, zygomaticofacial foramen, squamosal suture, temporal squama, zygomatic arch, temporal process of the zygomatic bone, zygomatic process of the temporal bone, external acoustic meatus, mastoid process, styloid process. This is the ethmoid bone, cristogale, cribiform plate, olfactory foramina. Sphenoid bone, lesser wings, greater wings of the sphenoid. This part's called the sella turcica, composed of anterior clinoid process, posterior clinoid process, optic chiasm, dorsum celli, hypophyseal fossa, foramen rotundum. This is the petrous portion. It has internal acoustic meatus, carotid groove. The brain sits in the anterior, middle, and posterior cranial fossa. Incisive foramen, median palatine suture, transverse palatine suture, palatine process of the maxilla, horizontal plate of the palatine, greater and lesser palatine foramen, vomer, pterygoid process, foramen lacerum, foramen ovale, foramen spinosum, carotid canal, jugular foramen, mastoid process, styloid process, stylomastoid foramen. Under the plastic is the mandibular fossa, foramen magnum, hypoglossal canal, occipital condyle, condylar fossa, nuchal line, external occipital protuberance, and I forgot the temporal line on the parietal bone. Okay.